Welcome back to the Weekend Show. Joining me as my guest host today is none other than Oyinbo Nigerian. Welcome to the program, Oyinbo Nigerian.
Thank you very much. Thank you.
How excited are you to host today's program? Have you done this before?
Not really. Not really. So normally we're the ones answering the questions, but today now ask the questions. So I'm excited. I'm
also very excited about that. The number to call in to share your thoughts on today's program is 080-537-89021. Again, that's 080-537-89021. You call into the program, share your thoughts on the issue we are discussing. Joining me on today's program, we have Douglas Emeka Okoro, who is a consultant neurosurgeon, and we also have Dr. Chimere Kanu, who is a digital health provider at Dial a Doc Direct. It's an initiative by the Abia State Government. Gentlemen, welcome to today's program.
Yeah. Thank you for having me. The Weekend for having us. It's Douglas Okor, O-K-O-R, short and sweet.
Okor. I like that. It's like okra, but it's okra. Okay, gentlemen, we're talking about the healthcare service in Nigeria. We've had a lot of feedback. We ran a poll actually on our social media regarding this topic, and a lot of people sent in messages regarding the deplorable state of public healthcare in Nigeria. As a matter of fact, one of our workers here went into the hospital for a setting pain in her body and was diagnosed with something completely different. So how do we, is this common? First of all, I think we should start with that. Is this common in Nigeria, or are these just random case or random samplings that we found, you know, to be true?
I think let's start for this, Osasu. You talk about public, Osasu,
yeah.
Osasu. Public health institutions will be similar to any public institution in Nigeria. So the first question is, what are public institutions like in Nigeria? What are the ministries, the departments, agencies like in Nigeria? That will be representative of what the public health institutions will be as well. So if you look at the issues of efficiency, of actually provision of service and stuff like that, it will be the same thing across board. So it's not surprising that we have major issues in our public hospital. And yes, we have major problems when it comes to diagnosis, looking after patients and stuff in our public hospitals, and it's expected.
Why is that? We need to, I feel we need to get into...
Well, it's expected for a few reasons. Number one, let's look at the issue of leadership in the country. Issues of leadership, either at the political level or at administrative level or at clinical leadership level. Okay? Fundamentally, we have major issues with what I call the value for human life in Nigeria. It is not a mainstream socio-political issue. And so, we're in electionary season now, right? And how many people do you hear talking about healthcare? Well, if you, in the UK, for example, during their electionary, they're talking about their manifestos. The National Health Service is a fundamental major problem. The last election in the US, Obamacare was a mainstream issue. So the problem is that the average, the political structure in Nigeria or governance in Nigeria does not care about the average Nigerian. And so it dovetails into what you get in terms of the service in a public hospital.
Interesting. Interesting. So, just a quick question. How do you feel, do you feel that health practitioners are doing enough to ensure the effective service delivery for Nigerian people?
Okay, well, the issues are actually quite multifactorial. There are a lot of issues that run deep, and these things have been in existence for a very long time. They didn't start today. So what we see is a consequence of years of neglect for the sector. So if we look at what's going on in the health sector now, whether we are giving our best is a function of we working within the limits of the resources that are available to us. So you can't give what you don't have. Even more so, you can't give more than what you have. So the issues are that we have a sector that is draining badly. I mean, it is bleeding so badly that issues like this, issues with healthcare delivery has come a very long way. For instance, talk about manpower in the health sector. Capacity. It's really in a very bad shape. We have a country where we have 198 million people, and you have we have about 40,000 doctors in the health sector. Yeah. Now, if you compare that ratio, if you say doctor to patient ratio, we have about 1 doctor to about 6,000 people. Now, that is against the World Health recommended of 1 doctor to 600 people. Okay? Now, it means that a doctor is working 10 times what a normal doctor would do anywhere in the world. So the figures are alarming. to the point that what happens eventually is that it comes down on the doctor, and you have a situation where burnout, you have a situation where people are not satisfied with their jobs and people are looking elsewhere. For instance, I read an article some time ago, and where in that article I was told, what I saw was that we have a deficit of about 233,000 doctors in this country right now. 233,000 doctors.
33,000 doctors.
Yes, to meet up with the 190, to meet up with the target of 198 million people in the country. So when you talk about whether we are giving the right value, whether the health sector is doing enough, whether the health practitioners are doing enough, there is much they can do within the confines of the resources that are available to them. Yeah. Talk about the amenities as well. We have about 30,000 primary health centers in this country. They are not sufficiently manned. Okay? Then you talk about the most people. Obviously, most doctors would like to work in the city centers or in the cities. And in the cities, that's where you find the tertiary health centers, and the tertiary health centers are the what's it called again? The
primary.
The general hospitals and the teaching hospitals.
Okay.
So most people would not like to work in your primary health centers because they know, the conditions are not favorable. Most people will always work in those places. So you find that services will concentrate to the cities. Primary health centers are draining badly, and you find out that you don't have doctors there. What you have mainly are you have your community health workers and the rest of them, and they are trying their best. Okay, so the amenities are not there, infrastructures are not there, then also there is a knowledge gap as well.
Is it possible, can we partially attribute the deficit in the capacity of doctors who are currently practicing in Nigeria to also our diversity in terms of seeking medical aid? For instance, some people believe that they would rather pursue traditional medicine than going through the regular, hospitals. So can we also attribute it, can we partially attribute it to that? The desires of Nigerians to place their trust in more traditional medicine than our Western, quote-unquote, medicine?
I think the issue, what we call it 3 A's, okay? Availability of services, accessibility of services, and affordability of services. So we look at accessibility, okay? I don't know if anybody, the people watching at home, if anybody has actually gone through the process of actually trying to access care in a public hospital. It is an extraneous and very bitter experience, okay? So if I'm the average Nigerian and I have a problem, and if I go to a native doctor or go to a herbal person, I easily access the care. The guy gives me my herbs and stuff like that. And I compare that with going to a hospital. And then when I go, they say, oh, go and pay for this there. Oh, go pay for that there. Oh, you go there and stuff like that. Man, I will go to the native person. Sure. Okay. So there are issues of access. Okay. So one of the fundamental things that we think we need to be doing going forward is really, really funding primary healthcare, because that's the bedrock
of every other.
He talked about the primary healthcare centers. You go there, you see buildings where lizards are occupying and stuff like that. Now, if you take a major chunk of what is going to the budget, whether it's 5% of the budget or 50, whatever it is, but pay a major chunk of that and channel it to the primary healthcare centers or the primary level of care. And then you now find out that you can actually prevent lots of problems coming up to the secondary level of care or the tertiary level of care. And I think that's fundamental in terms of, and that's what I propose. We're talking about solutions now. Yes. I think almost 85% of the budget for health should go to primary care.
Center. True.
Because that is where the people need it. If a poor man in a village has a stroke, he is done for. Because looking after a stroke patient is extremely expensive. Yes. So let's prevent it.
I spoke to the Minister of Health, Isaac Adewale, in 2016, and he made a pledge to build one primary health care center per ward.
My dear Osasu, it's not about building centers.
Exactly. So wait, hold on. Let me ask the question. The issue doesn't seem to be about the infrastructure. No. It seems to be about more of the management and the
leadership, management function.
Exactly.
I think that's what we talked about earlier.
Yes. How do we get to that? How do we, ensure that we're not just building empty hospitals with beds and, as you said, lizards and different animals?
Leaders, Osasu. People that are passionate, you understand, people that are courageous. And because to actually make that change happen, you need leaders with courage.
Yes.
For example, I propose something, taking 85% of the budget to primary health care. I'm telling you, the average doctor or nurse in the teaching hospital will challenge that. I say, no, We don't want that.
Exactly.
You know, so you need a courageous leader that will say, damn all of you. You know, this is what we need to do. We are talking about looking after Nigerians. Because when it comes to the issue of saying, hey, Nigerian lives matter, the Nigerian patients are worth it. You understand? We need courageous leaders that can make that happen.
And you know why you need to pay attention to primary health centers? Like I mentioned, we have about 30,000 of them. Now, general hospitals in this country, which are the referral centers are general hospitals and your teaching hospitals. The general hospitals are about 4,000 of them. Then you talk about the FMCs and your teaching hospitals. We have about less than 90 of them for the whole of the country. Now, if we have 30,000 primary health centers and we're not paying attention to them, that's a huge loss to us.
Absolutely.
What we should be looking at now is upgrading some of these centers, what we call polyclinics. Polyclinics are very dominant, or are predominant in some European countries like the UK. What they do there is that just in addition to what you have in your primary health centers, they now have specialist services also there. By doing so, people can be attracted to primary health centers as, you know, they know that value is being added beyond just maternal care, beyond just child care, because there's this common perception in the minds of people. When you hear of primary health center, what comes to people's minds is ANC, antenatal care. That is wrong. Primary health center is the basic and most fundamental service or healthcare service delivery for any country, for any nation.
In other words, if someone is diagnosed with diabetes or hypertension in a hospital, a general hospital or something like that, okay, and the person has been diagnosed, the follow-up and continued monitoring of such a patient should be at the primary health center. You know, so you shouldn't have that number.
And I shouldn't be seeing cases of malaria in a tertiary center. It shouldn't be that way. So now there's an Abuja declaration of 2001. In that declaration, they say 15% of budget, that's the least, 15% of every annual budget of all the 50 countries in Africa should be allocated to health. It's unfortunate, the highest we have gone, I think, is about 5.9%. I mean, 5.9%.
Because healthcare is not a mainstream issue.
It's not a mainstream issue in Nigeria. Nobody cares about it.
So how do we, what leaders are there that we feel like are in the healthcare system that are pushing for the healthcare, you know, to be transformed in Nigeria?
Well, like Chimere said,
yes.
Do you understand? It's been many years since there's been a decay.
Yes.
And of course, trying to reinvent the wheel and change that is going to take some time.
Yeah.
Okay, we will get there. Do you understand? But one of the key things is that you don't make changes by just wishing them.
At all.
Definitely.
Some pressure needs to come from somewhere.
True.
Okay, and that's why these kind of discussions are absolutely important. Pressure
I know,
needs to come from somewhere.
I know the lady I met about 5, 6, 7 years ago, Dr. Zainab. She does this cancer advocation, I think, and she's currently the wife of the Kebbi State Governor. And I know she's been doing a lot in the cancer research and a lot of things like that. So, I mean, I feel like she's here to transform the health sector, and I feel like she's been doing a lot. But there are just a few of them that I see that are actually putting their mind into the health sector.
I think there are different spots or pockets of excellence happening here, and there are people really pushing, people who are really passionate about the healthcare of Nigerians and stuff like that. What's going to happen at some point? I can call this the critical mass of people in health. What's going to happen? They're going to coalesce at some point. Like I said, it's going to take time. It's not going to be overnight. The service provision for healthcare for Nigerians, you know, is not going to come overnight like that. But what needs to happen is, one, we need to empower Nigerians with information and knowledge.
Yes.
Unfortunately, it looks as if, you know, I don't know if it's a Nigerian thing, there's this thing about actually hiding information from people. And that's one thing that I am really passionate about.
Very true.
You understand? We need to put the information and empower Nigerians. Once they're empowered, once an average patient goes into a consulting room, and the doctor says, oh, take this medicine, and the person says, oh, no, doctor, what is this medication you're giving me? What is my diagnosis?
And that brings me to something very, very critical. Sometime in October, November of last year, the Consumer Protection Council, in conjunction with the Federal Ministry of Health, they published the Patient Bill of Rights.
Patient Bill of Rights.
Now, in that Patient Bill of Rights, you have about 11 roles or responsibilities. You know that every person, healthcare receiver, healthcare provider, have roles and responsibilities outlined there. So if a patient comes in for an emergency and he doesn't get attended to, or the doctor is requesting that he must pay a certain fee, it clearly stipulates that the doctor should actually attend to the patient without the fee. But again, there is a responsibility on the part of the patient that after services have been rendered, he should pay a fee. So there is a document that holds everyone accountable in the health sector. So we should all go out there. Now, sometimes I try to ask people, do we have a copy of the Constitution in our houses? You know, that is a reflection of how much knowledge we are ready to acquire. So this information is out there. The Patient Bill of Rights is out there. People need to go. It's online also. You can actually download the soft copy. People need to go there, see what their rights are, know what their roles are, know what the role of the healthcare provider is, know what the role of the patient is, and know where your rights are infringed on.
Is this document, is this policy still applicable in this Dial-a-Doc initiative? Because the Dial-a-Doc initiative, you can correct me if I'm wrong, is you just pick up the phone and you have a card, and like an insurance card, and you pick up the phone and call a doctor. Doctor, I'm having a stomach ache. What do you think it is? So how does that work? And have you experienced any misdiagnosis, you know, since the beginning of this initiative? Because I believe it's an initiative by the Abia State Governor, Dr. Okor-Chimere, to ensure that all citizens of Abia State, whether you're in the rural area, whether you're in the suburbs, whatever the situation is, you have access to a doctor.
Yes. Now, the primary, how it's done primarily is that most of the services are tied to primary health center because we are trying to support the primary health centers and revive them.
The bedrock.
They're the bedrock of services, healthcare services in this country. You can't do much without them. So what we do is that the services are tied primarily to the primary health centers to support the community health workers, the CHOs, the people who are there. Most of the times they don't have the right expertise. Now what we do is that because they have some level of clinical knowledge, we work with them. Don't forget that they've been consulting too. They've been seeing cases as well. Exactly. We support them. We are not riding over them. We're not taking the job from them. So when they call us and tell us that, okay, see, we have a particular patient who's having headaches, body aches, bitter mouth, fever for a few days and all that. So, okay, I think this is a case of malaria. We ask the questions that need to be asked. We have a folder, we document. You have the patient's name, you have everything. Every patient have got their own information filed in the system. So we're not just doing any random form of consultation. So everything, you can still come back and call up a patient's folder. If there's been a case of malpractice or you feel that something wasn't done properly, you can always go back to the patient's folder and look at it. So we also have, put down, you know, a summary of the case and the management protocol, and we forward it to the person who will be managing the patient. So the information doesn't come straight to the patient. It comes to the person because we are co-managing.
I see, I see. So the patient isn't calling you directly.
Exactly.
They're calling their primary healthcare provider
because
first,
we want to,
who then liaises with you.
Because we want to raise a consciousness in people that primary health centers can still work. We want to revive them.
In fact, to move healthcare in Nigeria,
we need it
to work.
Yes.
They need to work. We don't want lip service. We want proper leadership in healthcare in Nigeria. One that is conscious of the fact that they must put in some work to actually make things actually happen. Absolutely important.
And again, I would like to remind our viewers, you can call in to share your thoughts on this subject matter. The number to call is 080-537-89021, 080-537-89021. I'm particularly interested in the fact that Dr. Douglas, you mentioned in the beginning of the program that in most developed countries, the issue of healthcare is at the forefront of national discourse when the political season is right.
Absolutely.
However, in Nigeria,
it's an afterthought.
It's an afterthought. We're talking more about federal character. Are the people who are running, are they from the north or the south?
Yes.
We're talking more about, you know, the way they speak English, you know, but we're not discussing the critical issues such as healthcare.
Absolutely.
I hear we have a caller waiting. Your name and where are you calling from, please?
Hello?
Yes, I can hear you. Your name and where are you calling from?
Yeah, I'm Charles. I'm calling from Abuja.
All right. What's your contribution?
Yes, I want to also ask first of all, I want to greet them. You go, Nigeria.
Marga, what done, sir?
They greet you back.
What done, sir?
My farm.
Go ahead. What's your contribution?
How do you tackle the issue of community health? Because it's very essential. And the way that people handle some of the patients is not palatable at all, most especially in the rural areas. Where you go, they talk to them anyhow, and that image is not there between the patient and the doctors or whoever is attending to a person who is sick. So how can we be able to harmonize it so that we can have a cordial relationship between patients and medical personnel? Because if you go to the rural area, people wouldn't prefer going to the basic doctors and then they expose what their problem is and go to the hospital to do that. So primary health, what is our focus on it? Because the guys that were talking about comprehensive analysis of people's data. So how are they tackling the issues of the primary health care process?
Thank you so much for your question.
Talk about the
Thank you.
of the rural area.
Yes.
Well, I think back to leadership and management again. In the corporate organizations, there's what they call corporate governance. Okay. In healthcare, there's what they call clinical governance. Okay. Now we need to really establish and enshrine clinical governance within every sphere of our healthcare delivery in Nigeria, be it at the tertiary level, secondary or primary level. Okay. And basically, what does that mean? It just means a leadership and management at these different levels, okay, that understand the key issues of risk management, understands the key issue of staff management, of things like effectiveness of and efficiency in using resources, in terms of looking at staffing, what kind of human beings are you actually putting to actually deploy care to Nigerians. He kept talking about doctor. It is not only doctors that deliver care in the healthcare space. Okay, you have other healthcare providers as well. Okay, we have cultural issues when it comes to the way the average healthcare professional will deal with the patient. Okay, the average healthcare professional, because of the environment, feels that he's doing the patient a favor. A healthcare professional who is paid to do a job feels that he's doing a patient a favor and will talk down on the person and stuff like that. It's just cultural. It's cultural. It's been like that for a very, very long time. And what we are saying is that radical change will come with creating a particular culture. Okay, if you're in a particular teaching hospital, for example, or a general hospital, or even a primary healthcare center, and there's already an enshrined culture based on the corporate cultural governance they have there, where customer service is top-notch. They talk to you politely, the people discuss with you and stuff like that. And you're coming from the general culture in Nigeria, and you come into that other culture, you will behave yourself. You will align. It's only natural. If a medical lab scientist, if a biomedical scientist from the UK comes to work in a blood bank in Nigeria, right? And somebody calls from the theater that, oh, this woman is bleeding, we need blood. And that medical lab scientist is rushing out, oh, okay, what do you need? The other medical lab scientist in an average Nigerian hospital will be like, what is wrong with this one? No, she na use sabi do pass and stuff like that. Now, if a medical lab scientist from Nigeria goes to the UK and is working in a lab, and then somebody calls from the theater saying, oh, we need blood. And I say, I beg, I want to go and pick my children. I need to go and eat. Do you understand? The average person, they will look and say, wow, what? Two different cultures. And thank God that culture is dynamic. We can change it. But it needs leadership
to enforce.
That is serious.
Yeah.
That will say, hey, the average Nigerian life is worth it. The Nigerian patient, that's my mantra. The Nigerian patients are worth it. So we need change from the head. Once the fish's head is rotting,
nothing more.
Yeah. You know, while we talk about the healthcare system like that, I think in the public sector, in the private sector, I think what I've done over the last few years, everyone's like, carry your wife abroad, make she go deliver abroad, this kind of thing. And I'm like, no, I'm going to deliver my children here in Nigeria, the same way I was born in Nigeria, the same way my parents and my grandparents were born here. Because I feel like we have, very good, talented people in Nigeria and doctors. We have some of the best of the best.
Nurses, physiotherapists.
Exactly. But from what you're saying, it's more of the leadership, at the end of the day. And I feel like we will get there eventually. I mean, with young people, my brother, the thing where I don't learn from you today, not this one. So I'm really impressed. And if we have young people like you that, are making some changes, and apart from knowing the problems, you are going out there and you're trying to make changes, in the health sector. And I feel like you guys will do very well, and you'll be the change that we'll have tomorrow in the health sector.
And as an addendum to that, I completely agree with you that in terms of the capacity of our doctors, I personally believe that Nigerian doctors are the best in the world.
Definitely.
However, we lack the facilities.
Yeah. True.
I had a conversation over the Christmas holiday with my therapist in South Africa, and she said to me that there was a case of a baby born premature. And the parents were very adamant about flying the baby to South Africa. And when she flew in with the ambulance flight, the medical ambulance, she was surprised that the doctor diagnosed the baby 100% correctly. The doctor knew what he was doing. So she felt bad as a medical practitioner that this family is wasting their money to fly this child all the way to South Africa for the same health care, the same capacity that she can get in Nigeria. However, she acknowledged the fact that due to the lack of facilities, functioning facilities in the Nigerian hospitals, the parents just felt more comfortable, you know, flying them to a country that can easily access these facilities if anything were to happen. I mean, I saw a deplorable case on Twitter of a makeshift incubator. A child was born premature and they used cardboards and fluorescent light. I was speechless.
We're talented in Nigeria.
Well, in a way, that's innovation. Innovation in a bad situation.
Exactly.
You know, I had the same problem with my wife. My wife had kidney stones, and you know, I took her around, and I was like, no, this issue, you know, I just married this girl, I don't fit allow anything to happen around. So I was like, let me take her, you know, let me take her abroad. I think it's cut off. So I think that's the incubator thing that they were talking about. But at the end of the day, you know, when I took her abroad, and they said, oh, they're going to do like laser for her and I don't know what. And we went into this machine and we paid a lot of money in regards to that laser thing. And at the end of the day, it was just one thing that was doing crack, 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 crack. And I'm like, that's not laser, you know, at the end of the day. And we came back to Nigeria with a tube in the stomach, and I'm like, no, this is not going to be possible. I'm not going back to that country. I went to a hospital in Gwarimpa, and the specialty is in kidney stones. And I paid a lot less than what I would have spent the whole travel. And this guy did an amazing job. I don't know Dr. Undi. I don't know if you know Dr. Undi. You know, really, really, really good. And, you know, we thank God up to today. We haven't had any problems with that. And I'm like, I don't need to travel abroad to get medical help.
I think, remember, I talked about 3 A's earlier on. Availability, affordability, and accessibility. The truth is that there are major players in the private healthcare space in Nigeria that are doing an absolutely fantastic job. But that's availability. They are beginning to help us with availability.
True.
But when it comes to affordability and accessibility, the average
Nigerian cannot afford
they cannot access that care. And so, when you talk about tertiary care, that really complex tertiary care or quaternary care, which is like the 4th level of care, which is what I do and stuff. Let's try and prevent people from getting to that level. And back to what I said again in terms of solutions, let's pump more money to the primary care, whatever, so we can actually prevent people coming up to that level. Of course, let's reduce the amount of money from the federal or whatever that is going to the teaching hospitals. Let it just be maybe money for just recurrent expenditure, okay? And let's get private consortiums and groups to take over those teaching hospitals and federal medical centers. And let me see any consultant or any doctor who would be doing 6 surgeries in a year and collecting salary every month. Because when you have private consortiums that run those places, they want efficiency and effectiveness, and they want proper outcomes.
So you believe in the privatization of this
absolutely, some sort of public-private partnership, whatever model they want to use.
But do you think the people will be able to afford it still at that level? Because that's
why it's public-private.
That's why it's public-private, and because of scale.
Even if there are subsidies, it still will not be available to the poorest of the poor in our society. I mean, from the charity work that I've personally done in my capacity, I've had to give just 1,000 naira for antenatal care, prenatal care to people because they can't afford it. So if the government can't even provide that, then in a PPP, you're going to shut out majority of the population which cannot afford basic essentials.
I'm talking about PPP at the tertiary level. And I'm saying that let most of the money go to the primary care. So that lady who needs antenatal care, you understand, can access it very easily. Of course, you tie it to a proper national health insurance system. Or a health insurance system that has a national health insurance, but is coordinated with the state health insurance system. So we just need systems that are coordinated and integrated.
Do you think
there's too much fragmentation in the system?
The state governors can play a big role in regards to
Absolutely.
that?
Let them show some leadership.
They can, but the challenge we are faced with now is that even the primary health centers don't have a form of accountability.
Okay.
Now, ideally, we have a state, or we have a country where the state government and the local government are sharing accounts. So now we're looking at disbursement of funds.
So autonomy.
Autonomy, exactly. Are the local governments autonomous? Can they access these funds? Because they're the ones that are the closest to the grassroots. So if the primary health centers, which are closest to the grassroots, cannot access the funds that are needed to support the grassroots because there is no autonomy, then that becomes a bigger issue.
Absolutely.
Dr. Chimere, Dr. Douglas, thank you guys so much for your time. I
Thank
feel we
you,
could talk about this for 8 hours straight.
Thank
So
you.
we'd love to have the both of you back on the weekend show again.
Thank you, Osasu.
We'll take a break right now. When we return, we'll bring you the social media trends of the weekend show. Don't go anywhere.